Can we hi?
Alright, so hi guys, my name is Tara Kettler. As most of you know, I'm going to be doing a presentation on falls and how to decrease falls in the workplace setting. So this is for my capstone project. I'll be graduating this December with my bachelor's in nursing. In this PowerPoint presentation, I'm going to go over 5 different studies that I found, a PICO question, and then interventions on what we can do to decrease falls. So the problem statement is, of course, the increased number of falls that we have in the hospital setting. A fall is defined as an event in which a person inadvertently gets to the floor, lowers down to the floor, and then each year 700,000 to 1 million patients fall in the United States in hospitals. And then I gathered data based off of our board. As of August, we had 13 falls, with 2 falls that resulted in injuries, and then the goal for the year was 15 falls. And on this unit specifically, we specialize in cardiothoracic, and we also take ICU patients, PCU patients, and med-surg tele. So why is this a problem? Falls the patients have an increase in injury rate, they have an increase in mortality rate, decreased quality of life, a longer hospital stay. It's just overall just not good. So the first study that I found, its purpose was to prevent falls through a 3-step process. The interventions that they used specifically was the TIPS interventions, which is tailoring interventions for patient safety. And then they posted the laminated TIPS poster at the bedside, and they also had the computer lock screen as the TIPS screensaver. The study was conducted in the United States on a neuro med-surg unit, on 2 different units. Both units reached at least 80% adherence with their goal. There were 1,209 audits for patient engagement, and then 1,401 audits for the posters at the bedside. So this study ultimately showed that there was a decrease in falls using the TIPS protocol. And then this is the poster on what the nurse would use and what they post at bedside. So it's kind of a little checklist, and then it shows, you select if they've had a history of falls, how they walk and assist, and then whether or not they need the bed alarm on. The next study that I evaluated, its purpose was to update the content on a fall prevention educational video that they would show their patients. The interventions, they updated the video and they showed them to the patients, and they also gave them a pamphlet about fall prevention. The video was just basically giving them education on how to use their call bell, the reason why we do these things, and what would happen if they don't follow with their plan of care basically. This study was completed in Asia on a med-surg unit. They had 202 patients for the sample size. They conducted the study from October of 2016 to January of 2017. And this study also showed, with the video and with the pamphlet, that there was a decreased number of falls. The third study I did, its purpose was to determine if a fall prevention kit will help reduce falls in the hospital. And the interventions used, it was a nurse-driven fall prevention toolkit. The nurse would build a patient-specific toolkit for that patient, and then also would involve the family. And the nurse would use the TIPS protocol, the Morse Fall scale, and the TIPS poster at bedside. This study was done at 3 different academic medical centers from November of 2015 to October of 2018, and it showed there was a decrease of falls from 2.92 to 2.49 per 1,000. So ultimately, again, the TIPS showed that there was a decrease in falls. The fourth study that I did, its purpose was to evaluate the effectiveness of videos, educational videos, to involve patients with their plan of care to help decrease the fall rate. So what they did, they showed the patient a 3-minute educational video, basically the same thing as the second study, on what to do if they need to get up, what would happen if they get up, and get up without assistance. And then the video actually showed basically a right scenario and a wrong scenario. I wouldn't say it was there to like try and scare them, but just try to get them to use the call light appropriately. And this study was done at a teaching hospital in the Midwest. Its sample size was 124 patients. There was only 1 fall in the intervention group, but a total of 7 falls between the intervention and the control group. So technically the P result didn't show that there was a drop in falls, but since there's only 1 fall in the intervention group, it does count that there was a decrease in falls. The last study that I did is also about TIPS. Its purpose was to determine if the TIPS protocol would reduce the number of falls. And they used the TIPS protocol, same thing, it was individualized for each patient. The study was done at Southern California. The study lasted for a total of 8 weeks, 4 weeks pre-intervention, 4 weeks post-intervention, and it showed a decrease from 10% to 7% in falls. So the PICO question that I came up with, it's population, intervention, comparison to what we currently do, and then outcome. So the question that I came up with, how does patient engagement using tailored intervention for patient safety protocol and fall prevention videos compared to the usage of the Morse fall scale that we currently do, bed alarms, chair alarms, the yellow socks, yellow armbands, that affect decreased number of falls. So basically we're comparing if the tips in the educational video compared to what we do now would ultimately decrease the number of falls. So for evidence-based practice, I chose the Iowa evidence-based practice, and the Iowa model identifies the issue, and then they determine what they can do to implement change. And there's five steps for this practice. So ask a clinical question, which is the PICO question that I stated above, search literature, which is the 5 studies that was also stated above, appraise the evidence, implement practice changes. So I was thinking if our educator thought this was appropriate, I don't know, maybe go on to the next steps on what we would need to do about adding on like the ELMS education stuff that we do. And then evaluate the effectiveness. I would probably say my goal was to evaluate for a year, and then with the tips and the educational video compared to that year compared to this last year, and see if there is a decreased number of falls. So technically that's the end of my presentation, but now we have post-discussion questions that I would appreciate if you guys could help me answer. So the first question, is the intervention appropriate for the workplace, and why?
I like the tips idea where we do like a tailor-made video for the patient, because I think some of the education lacking is just that the patient's like, oh, you wanted me to call you? Because we sometimes assume, and so if we have a video, I know we had that video with the CEO at the beginning, but everyone just, it's kind of drones on. But I think it would be very interesting to have that tailor-made,
yeah, that's really interesting,
video for the patient.
And I did see, actually, after I started working on this presentation, I saw in one of the rooms that the poster's at the bedside, but I never even knew it was there. I never had any sort of like education with it. So it's here, but we don't use it.
and they're not like exactly like visually, like they kind of blend in. Whereas I've seen in other hospitals, they have a special thing right above the patient's head in the bed that says do not get up, like, ask for help, or
Yeah.
I think
call
we used to
it.
have that legacy
Like,
on
we
one of the old
did on one of
units
the
when they're
units.
laying in bed.
Yeah,
but
I worked on a unit that said like call, don't fall or something.
Yeah.
Yeah.
Yes. And they're I think the 5th floor, they have signs all over the place, like
Mhm.
get up, or they want to get their people up and moving, but also highlighting fall risk and stuff, so.
Next question, how will the intervention positively or negatively impact the nurse's obligation to provide holistic care, cultural sensitive, and patient-centered care to the identified population of patients?
I would hope for a positive impact,
Mhm.
because again, it's the patient being informed, informed almost in a passive way where the nurse is not actively, yelling at them.
And it's tailored to them.
And
It's not every single patient, like,
Sure.
you know what I mean? Like, so I think it would be a positive impact.
That's my goal, is to have a positive impact on it. Next question, what are the legal and ethical implications for nurses who will be implementing the intervention, such as allocating resources to implement the intervention, sustaining the intervention, and staff education?
I mean, I think ethically as nurses, it's our job to keep them safe, so I think this is a good thing to, anything that helps bring awareness to, patient safety, that's.
Ultimately, that's the goal, is to keep the patient safe and give them the best care that we can.
I think when it comes down to allocating resources and your staff education, the professional governance team would be where to start. Or since we're trying to grow that, and then because changes made by nurses tend to stick more than us saying, hey, do this instead, and implementing a change. And then, I think you'll get better feedback or more feedback if you do it that way.
And I did ask Christina, because I know she was on that board, if she wanted to attend to this, but I don't think I ever actually gave her the day and time that I was doing this. But if I have, I can just, if I have to post this on YouTube, I can just like forward her the video or forward her the PowerPoint. And Christy, who's the board, or who's like the president, I used to work with her, so I could forward all this stuff to her as well, so.
She might have you come to professional governance and.
I know,
Give a
Christina.
I think there's one on Tuesday.
I was gonna say, there's no maybe, you're gonna get invited. She invites everyone.
Yeah, next Tuesday.
I think it's Tuesday, yeah.
The agenda's already out though, they may wait a month, you think?
Yeah, probably. I doubt it would be next week. That's a bit.
Good.
It's pretty fast, yeah.
3 days, come on.
Next question, how will implementing the intervention positively or negatively impact the interprofessional, multidisciplinary teams such as workload, job satisfaction, ability to provide safe care, and ability to participate in evidence-based practice?
Anytime that we get a patient or their family involved in their care, I see that as a positive. It gets them motivated, usually, to want to get out of here, instead of like, I'm just gonna do what I damn well want, so that I can,
Right.
so I can do this by myself, so just,
Yeah, I definitely think it helps having family here to kind of help push the patients.
I think it positively impact the workload. Again, I'm coming from that angle where the patient's being educated, kind of passively, not from nursing, but from the, tailor-made video.
And I had an idea that I don't know if the admission nurse is still a thing anymore, but have the admission nurse whenever
It is not.
Really?
That is.
No,
We
they
have today.
changed it to a discharge nurse.
No, we have 2 of them. It was yesterday or today. We had 2 admission nurses.
Oh, I thought,
I think there's still some lingering out there. Just saying.
Well, if they have it or
I
if they
thought
don't
they
have
changed
it.
it to a discharge nurse. I swear I heard in huddle in the morning.
oh yeah, Alyssa's been filling in as a discharge nurse, she's here today.
Anyway, I think
Yeah.
that would be
I-
good.
Yeah.
I was
Yeah.
thinking just have them
Yeah.
show them the
No, like
video
for
if it's
sure.
a 3-minute thing.
Yeah.
Okay, a few more questions. What is the workplace's process for implementing the intervention? this I wasn't sure on, besides passing it over to you guys.
Professional government.
I think it
I
comes
was
from
gonna
your
say,
professional
yeah.
governance team.
That's
Like,
one of the reasons people aren't going to professional governments anymore is because sometimes you bring an issue up and then you gotta wait for it to go through 20 other people before you get approval on something. And that's kind of used to professional governance, you bring things up and
We get something
you
done.
get something done, usually in the same day.
I mean, if this is something that we're really thinking about doing, maybe we do like a pilot program on our unit.
I was gonna
If-
say,
if,
like,
like,
if it's
if
something
that's
like
the-
even just like.
And see how
what
it
you guys-
goes
you
and then
guys-
take it to professional governance. I mean, who's to say that we can't? You know, we're working on getting a shared governance reinitiated on this unit. So who's to say that could not be something that we look into as a unit, do a trial, take it to professional governance, depending on how our trial goes. And, you know, see where we go from there and see if it's something that we need to
If
initiate
it's worth
house-wide, yeah.
showing or
I mean,
passing.
that's just a thought.
Next question, what are well, I feel like we kind of just addressed this, what are the barriers? If we have so many steps now that we have to take to get something implemented, it's a barrier. How can we overcome these? I feel like we just addressed that as well, doing a trial run on our unit and seeing if it goes well, then we pass it on. Last question, who are advocates to involve in implementing the intervention? Why are these people advocates?
The advocates would be nurses.
The staff.
Your staff, yeah, your bedside
Everyone.
nurses.
Everybody at the bedside.
Earlier in this semester, I had another homework assignment that I had to do. And one of the nurses that I interviewed, she was saying, why does everyone not set the bed alarm? Doctors, like dietitian, PT, OT, because
Interesting.
she sees that it's an issue where, you know, physical therapy will get them up, put them back in bed, and not set the bed alarm, and you go in, and it's like, what the heck? So, I thought that was interesting with what she said there.
I remember when I did clinicals at St. Francis, it was that way, everybody that came into that room, it was their job to check it.
Huh, kinda like that idea.
That's where, you know, the staff take accountability.
Right. I feel like we're all a team here for one thing, so.
Common goal.
Okay, well, that's the end of the presentation, so thank
Good
you
job.
guys.
Wow.